Welcome to Healthcare Talks. I'm Alex. Today we're diving into a topic that many of us encounter at some point in our lives, going to the hospital. Whether it's for a routine checkup or an emergency, understanding what to expect can make the experience less stressful. With me today is Jamie, our health specialist. Welcome, Jamie.
Thanks, Alex. It's great to be here. Hospitals can be intimidating, but knowing what to expect and how to prepare can really help. Let's check some key words. 1. Hospital. A healthcare facility where patients receive medical treatment, emergency care, surgeries, and other health services. 2. Emergency. A sudden, urgent situation requiring immediate medical attention, such as chest pains or severe bleeding. 3. Routine checkup. Scheduled medical examination to monitor health and prevent illness. 4. Triage. The process of prioritizing patients based on the severity of their condition to ensure urgent cases are treated first. 5. Registration. The check-in process where patient details and medical history are recorded upon hospital arrival. 6. Medical tests or examinations. Procedures like blood tests, X-rays, MRIs, ultrasounds, or physical assessments used to diagnose or evaluate health conditions. 7. Discharge. The process of releasing a patient from hospital after treatment, with instructions for recovery. 8. Treatment area. The clinical space where patients receive medical procedures, tests, or treatments. 9. Overnight stay. When a patient remains in hospital for one or more nights for observation or treatment. 10. Inpatient. A patient admitted to the hospital who stays for at least one night. 11. Care team. The group of healthcare professionals responsible for treating and monitoring patients, including doctors and nurses. 12. Follow-up. Additional medical appointments or procedures scheduled after discharge to monitor recovery. 13. Patient advocacy. Supporting or speaking on behalf of a patient to ensure their needs and concerns are addressed. 14. Emotional support. Assistance provided to help patients cope with stress, anxiety, or emotional challenges during hospitalization. 15. Discharge instructions. Guidelines given to patients about medications, wound care, activity restrictions, and follow-up care after leaving the hospital. 16. Physical therapy. Rehabilitation treatments aimed at restoring movement and function after injury or illness. 17. Infection control. Measures taken to prevent the spread of infections within healthcare settings. 18. Anxiety. Feelings of worry or nervousness often experienced before or during hospital visits. 19. Preparation. The process of organizing what to bring, what to expect, and understanding procedures before hospital visits. 20. Healthcare facility. A location equipped to provide health services, such as hospitals, clinics, or urgent care centers.
Absolutely. So, Jamie, let's start with the basics. What are some common reasons people need to go to the hospital?
There are quite a few reasons. Some of the most common include emergencies like chest pains, severe injuries, strokes, or allergic reactions. People also go for scheduled surgeries, childbirth, or diagnostic tests like MRIs and blood work. Chronic illness flare-ups, infections, and unexpected medical problems also often require hospital visits.
That makes sense. It's interesting how some visits are planned while others happen unexpectedly. Can you talk about what someone should do if they experience a sudden emergency?
Sure. If someone experiences a medical emergency, like chest pain, difficulty breathing, severe bleeding, or sudden weakness, it's critical to call emergency services immediately, such as 911 in the US or the local emergency number. Do not try to drive yourself unless absolutely necessary and safe. While waiting for help, if possible, keep the person calm and comfortable. Time is crucial in emergencies, especially for heart attacks or strokes.
Definitely. Now, for non-emergency situations, how do people decide whether to go to the hospital or visit a doctor's clinic?
Good question. Many minor medical issues like a mild fever, sore throat, or small cuts can usually be handled by a primary care doctor or urgent care centers. But if symptoms are severe, worsening, or if there's uncertainty about the seriousness of the condition, it's safer to go to the hospital. Also, certain conditions like chest pain or severe abdominal pain should prompt immediate hospital visits.
That makes sense. It's interesting how some visits are planned while others happen unexpectedly. Can you talk about what someone should do if they experience a sudden emergency?
Sure. If someone experiences a medical emergency like chest pain, difficulty breathing, severe bleeding, or sudden weakness, it's critical to call emergency services immediately, such as 911 in the US or the local emergency number. Do not try to drive yourself unless absolutely necessary and safe. While waiting for help, if possible, keep the person calm and comfortable. Time is crucial in emergencies, especially for heart attacks or strokes.
Definitely. Now, for non-emergency situations, how do people decide whether to go to the hospital or visit a doctor's clinic?
Good question. Many minor medical issues like a mild fever, sore throat, or small cuts can usually be handled by a primary care doctor or urgent care centers. But if symptoms are severe, worsening, or if there's uncertainty about the seriousness of the condition, it's safer to go to the hospital. Also, certain conditions like chest pain or severe abdominal pain should prompt immediate hospital visits.
Thanks for clarifying that. Now, once someone decides to go to the hospital, what should they prepare or bring with them?
It's helpful to bring identification, health insurance information, and a list of current medications. If possible, bring medical records or test results related to the issue. Also, prepare a list of symptoms, when they started, and any allergies. Wear comfortable clothing and, if applicable, bring someone to accompany you or help communicate with medical staff.
That's very practical advice. Let's talk about the hospital experience. What can someone expect upon arrival?
When you arrive, you'll usually check in at the reception or registration desk. You'll be asked about your symptoms, medical history, and insurance details. Then you'll be taken to a triage area where a nurse assesses the urgency of your condition. This helps prioritize care. Depending on the severity, you'll either be sent directly to a treatment area or asked to wait in a designated zone.
Waiting can be stressful. How do hospitals manage patient flow during busy times?
Hospitals often have protocols like triage to ensure that the most critical cases are seen first. During busy periods, wait times increase, but hospitals try to communicate openly with patients. Some hospitals have separate areas for less urgent cases, so minor issues don't block treatment for emergencies. It's always good to be patient and calm during these times.
Once in the treatment area, what types of tests or examinations might a patient undergo?
It varies depending on the case. Common exams include physical assessments, blood tests, X-rays, ultrasounds, or more advanced scans like MRIs. Doctors may also perform procedures like inserting IV lines or giving injections. The healthcare team will explain each step and keep you informed.
That's reassuring. Now let's discuss a sensitive topic, hospital stays. What should a patient expect if they need to stay overnight or longer?
Hospital stays can range from a single night to several weeks, depending on the condition. Patients are admitted to specific wards or units, like medical, surgical, or ICU. They'll have assigned nurses and doctors, and they can expect regular monitoring, medication administration, and possibly physical therapy or other treatments. Staff members are there to support both health and comfort.
How about communication during a hospital stay? How can patients ensure they get the care?
Communication is key. Patients should feel comfortable asking questions about their condition, treatments, medications, and discharge plans. Keeping a list of questions beforehand can help. Also, don't hesitate to inform staff if you're experiencing discomfort or side effects. Family members or friends can also advocate on your behalf if needed.
That's excellent advice. Now, after treatment or surgery, what does the process of discharge look like?
When doctors determine you're ready, you'll receive instructions for recovery at home. This includes medication schedules, wound care, activity restrictions, and follow-up appointments. It's very important to follow these instructions carefully to ensure proper healing. Sometimes hospitals provide written instructions, and your care team may also schedule home health visits if necessary.
And what about the emotional aspect? Going to the hospital, especially for serious issues, can be quite stressful.
Absolutely. Hospital experiences can be overwhelming. Sleep disturbances, stress about health, and unfamiliar environments can take a toll. Support from friends and family, staying informed, and open communication with staff can help. Many hospitals also offer counseling or patient support groups to help cope emotionally.
That's really good to know. Lastly, what tips would you give to someone who might be anxious about visiting the hospital?
Acknowledge your feelings. It's normal to feel anxious. Preparing in advance, like knowing what to bring and understanding the process, can help ease fears. Remember that hospital staff are there to help and prioritize your well-being. Bringing a loved one for support is also beneficial. And finally, practice deep breathing or mindfulness techniques to stay calm.
Great tips. Jamie, thank you so much for sharing your expertise today. I think our listeners will find this very helpful.
My pleasure, Alex. Remember, knowing what to expect and being prepared can make hospital visits much less daunting. Stay informed and take care of your health.
And that wraps up our episode on going to the hospital. Thanks everyone for tuning in to Healthcare Talks. Be safe and don't hesitate to seek medical help when needed. Until next time.
Goodbye, everyone.